Hello, everyone, and thank you very much for watching. This is the third panel in the health theme, and I hope it's going to be an interesting one because we've got a group of very experienced women from different countries. I've got with me Dr. Aileen from the Philippines, and she is the chair of the World Organizing Family Doctors and part of the Working Party group. And I've also got from Cox's Bazar, is it? Yeah, in Bangladesh, Dr. Tasnova, and she's a public health professional working in the humanitarian crisis at the Cox's Bazar. At this point in time, she's an emergency health officer dealing with the COVID-19 response. And from Pakistan, I've got with me, and I'm calling you Tanzila, the serial entrepreneur, because Tanzila she has done a lot of things. She's an author, a filmmaker, and her theme is disability. One of the good projects that she's working on is Girly Things. So hop online and check it out, girlythings.pk for Pakistan. Okay, ladies, what I would like to do first, before we start, is acknowledge the traditional owners and First Nation people in Australia here, the Turrbal, the Yagara, and the Jagara people. And I also acknowledge the Indigenous custodians in the lands from where you come. Welcome. So I'll go to you first, Dr. Tanzila. Give us an idea about the situation that you're working with. I understand that you're working with the Rohingya refugees, and that currently there are almost like more than 500,000 refugees in the Cox's Bazar. So give us a snapshot of what is it like in a situation like that.
Thank you, Faiza. So this is Dr. Tasnova. So I'm talking from Cox's Bazar, and I'm currently working as emergency health officer. So the situation here is very much difficult, becoming day by day, and especially for the displaced people from Myanmar. They are facing very much difficulties living here in the camps. Currently, there are 8,55,000 displaced people are living here, and more than 4 lakh host people. So in total, there are 1.24 million people in Cox's Bazar. And as of today, there are 2,630 cases, confirmed COVID cases here. And in the targeted community, there are 50 cases have been confirmed and 5 deaths there. And in the host population, there are 35 deaths occurred. In the camp, actually, there are more than half are the women and girls, that constitutes 56%. So as they were already in some pre-existing issues, and in COVID-19, it has become more difficult because the camps are very much crowded and densed, overcrowded there, and they are living in very temporary structures in a very dense population. So it is tough to maintain the social distancing there, and to make them adapted to the habit of frequent hand washing is also very much tough. They are not habituated with this behavior. So we are working with our community volunteers, which are community-based volunteers. We choose our volunteers from that target population. And there are also, we maintain the male and female ratio, so that they are giving the door-to-door services with some IC materials, BCC materials, and some audio messages, and the key messages to them. What is COVID-19? What you should do? How we can prevent of getting infected from COVID-19? These messages are giving to them, and the audio messages are there is very much big barrier, that the language barrier. So the audio messages we developed in their language, and that messages have been circulated in the community. We are also involving their religious leaders also, the imam from the mosque. They are the religious leaders, and the maji, who are the community leaders. We are involving them also to motivate their people, their community, so that they get interested. Maybe it will be beneficial for us, so they will the acceptance will be increased. And we are also have a provision of some community safe spaces that are for the, especially for the women and girls. There are also a child corner, so who have little childs, so they can come with their children. So they do very much participatory group discussions there. They get the informations from there, uh, like they're
Yeah,
very much culturally, and they're so much social norms. They have restriction of movement. They have lack of access to the information. So we try to give it to door-to-door services, who are like behind and who have the access to go out of their home. They can come to these community safe spaces for women and girls, and they get the information here. They learn here, they enjoy here. There are some games and other activities to
mm,
motivate them, or so that they can
yeah,
enjoy. And there are some skill training also, like sewing, this kind of activities, so that they can become financially independent, or it works for the woman empowerment also.
yeah, that's
So
great.
we
Thank
are
you so
working.
much. Yeah, that's great. Probably I'll come to Dr. Aileen because we're talking now about displaced people, and you're working with the Marawi population who've been displaced for a range of reasons. Just again, very quickly, give us an idea about the Marawi people as a group, and how they're dealing with the current situation. I mean, being displaced in itself is problematic. And I understand there are probably 77,000 families, which is more than a quarter of a million individual people who are displaced in their own country. So give us an idea about what does that look like when there is a pandemic like this one.
So thank you very much for giving me this platform to share the work that CARE Philippines is doing among internally displaced population in the city of Marawi, which is in the autonomous region of Muslim Mindanao. The Philippines is a very culturally diverse country. In the southern part of
Mm,
the Philippines, there is where most of the Muslim population live. I am a Christian. I'm a Catholic. So from that alone, you could already see that I may encounter some difficulties in working with people who belongs to a different religious belief or religious orientation as I am. But then again, being a survivor myself of a big disaster, I realized that in disaster situation, um, the experiences that we have are very, very similar. Experiences of being isolated, being helpless is universal, and it transcends religion, it transcends culture. So to give you a conflict, the armed conflict in Marawi has been long standing. It has been there for several years. But it was only in 2017 that there was a siege, there was an armed rebellion that happened in this city. and it has caused so much damage to the health infrastructure. And usually in disaster settings, non-communicable diseases like hypertension and diabetes are not a priority, right, Snova? Usually the focus is on trauma and in infectious diseases,
Mm,
especially in the early phases of a response. But then we know that because of the changing morbidity patterns, there are now more people who are suffering from hypertension and diabetes. So CARE Philippines, cognizant of this, uh, decided to do a project, a community-based project among the internally displaced population in Marawi, wherein we tried to rebuild the healthcare delivery system specifically focused on hypertension and diabetes. We started this project last year, around the second half of the year, and I think it is providential because, as we all know, in COVID-19, hypertensive patients and diabetics belongs to the vulnerable population. If they
mm,
get the infection, they are at high risk for having a severe form of illness, and most deaths are seen in patients who have these comorbid conditions. So it is very important that patients who are hypertensive and diabetic would have good control of their blood pressure and blood sugar. So with our field volunteers in Marawi, doing house-to-house monitoring of all the patients that we have identified during the household profiling that we did last year, wherein we
mm,
did active case finding. These patients who are vulnerable, the hypertensive, the diabetics, the elderly, the pregnant women, all of them are being visited by our volunteer community health volunteers. And they are being given education, IEC materials. They're being monitored. Their blood sugar and blood pressure is being monitored. And we also provided them with hygiene kits so that they would be able to have access to basic wash commodities like soap, water, because one of the problems also in the relocation sites is the access to potable to running water,
mm,
like in most evacuation centers. But at least they are now in temporary relocation sites and they get water delivery every so often. But then we have to teach them how to wash their hands properly and teach them why it's very important to wash their hands, along with other other ways by which we can prevent COVID-19 infection. So we are able to do this teach in or to do these family teachings when our health volunteers would visit the homes as they check on the patients that they are monitoring. Also, because of the COVID-19 pandemic, we had to shift to some other forms of health education messaging. We shifted to the
mm.
use of social media. So we have a Facebook page, and then we also did some text blast. We send out SMS, short messages to our patients just to check on them, like how are they doing? Did they take their medicine today? Did you exercise today? Because we cannot do it anymore in a face-to-face. Then I also set up a telemedicine, a teleconsultation portal through Messenger and Viber. So our community health volunteers I do telehealth, remote medicine. So I'm here actually in the capital now because travel is not yet allowed between the islands. We are an archipelago of more than 7,000 islands. And Marawi is in the southern part. So I am limited I cannot travel at the moment. So whenever I would see patients who would need to be checked, like their blood pressure is spiking because of the reports that I'm getting from the field, I would check on the volunteer and ask them, why is this patient having elevation of blood pressure? And so we would try to assess the patient and do some intervention. So we're hoping that by this,
That's great.
we would be able to protect the vulnerable group and hopefully increase their chances that they will not be infected. And if they even if they become infected, we would have a better chances of survival.
Yeah, that's very informative. Thank you very much for that, and I'll continue the conversation about displaced people and refugees and so on. But I would like to come to you, Tanzila, because you work in the area of disability, and that in its own right presents difficulties and challenges. I mean, COVID has presented difficulties and challenges for everyone in urban settings. It exacerbated it in rural settings. But for a person who has any form of a disability and who has to rely on support from somebody else, that is an extra layer of challenges. So give me an idea about the work that you're doing and how are you assisting women in particular, women and girls, because women and girls have also got their own complexities in terms of health and so on.
It's a benefit to have a disability, and when you're growing up in a country that has been through so much history of violence and suppression, you get to see every system with the lens of disability. And in my working, in my finding, I realized that it's not just one type of population with a body impairment that we can label as disabled and just put them in the corner. It's the entire world that somehow is facing some sort of disability, and there are certain systems that disable us, women and men and transgenders and many other communities out there. My work took a lot of shape in terms of health when I realized that women face huge barriers when it comes to accessing healthcare. And I was lucky to be part of a system like this one, that of WOW, that enables me to talk about a lot of issues that we feel like I have a voice. I'm privileged for that, but I still don't have access to the products that I might require in my daily life, products being sanitary napkins. And during this era of COVID
Mm.
19, access to even masks, I still have to depend on a man or a woman to get me those products. And because of COVID 19, it's also a pity that the fight for disability rights has been all about accessibility. And now, once that has been shelved, I just feel that we're back to ground zero, because all the opportunities lies once these communities, the ones with body impairments, they get to have a life outside their homes, a chance to earn livelihood and also a chance to spend that livelihood. But all that seems to be shelved right now, and we're not prepared to find new systems. Yes, technology helps, but technological wise, the general populations are not that financially secure to have those gadgets. Probably they can't even afford Wi-Fi at home. They don't have smartphones. 70% of the population here in Pakistan is agricultural. So the women and men with disability that we're talking about are living in villages. They might have a phone, but that phone does not offer too much in terms of information, access, or anything like that. I think I want to dedicate my life in terms of giving access to products, because no matter how much are we talking, if we do not bring these products to the right users and enable them to have a lifestyle around them, then I think all the work empowerment is just talk and no walk. So my job, girly things, is all about making sure that these women can order these products on their own terms. And once the product reaches, it reaches to them. It's a complete anonymous packing. None of their family members, not even their husbands or their children, need to know what's inside. There is no branding. And because of COVID, we've had more access in terms of villages. Now we're getting more calls from villages. And initially we had a mobile application because we wanted users to just have visual remembrance and just operate. But now we also have a website, a hotline. All our social media accounts are open, and we tend to give these consultation about what products to use for COVID, for protection from COVID-19, and also for menstrual health care. And now we've also started providing products for reproductive health care, for example, pregnancy strips. But we're in the process of getting some medical doctors on board to provide products for pregnant women and women who've gone through childbirth and they need like post childcare childbirth products or services, and also information and products needed for safe abortion. So these are huge areas and they're missing,
Mm.
and I think we need to put in more of our resources, not just verbally but physically, into ensuring that these bridges are met. And my disability came in the most handy to make all of this
That
happen. It was a blessing.
that's awesome. Thank you so much, and you're inspiring in the passion that you're showing and in the depth of your understanding of the issue. I guess when you were talking, Tanzila, I was just thinking, how are you funding all this?
I am funding it from my pocket money initially, but I've been an entrepreneur for a while. I have no investor because it's very difficult to walk into a room full of men and start talking about my startup, but the conversation moving towards biology, because somewhere they dismiss my model saying women have been menstruating for ages, they can't remember their date. And I'm like, back to school. So it's very difficult to talk about menstrual hygiene in the entrepreneurial space. And sometimes I think my startup has been the first one to take reproductive health care or SRHR into a space heavily dominated by men, and they hold the money and power. So we need more investors and more funders who are women because they really understand the problem. And once it's not a female problem, it's a society's problem. Every problem that we associate with women, it's not a women's problem. Somewhere the beneficiaries is everyone.
Absolutely. So, can people go to your website and donate? Like, do you have that capacity? And if not,
No,
please put it, because
no.
as part of you know the global 24 of WOW, a lot of people will be listening to what you're saying. And
Yes.
unlike me, I'm saying, well, this is amazing. I want to help. What can
And
I do?
and and the reason why we don't have a donate button is because we are a business. So what we need are business collaborations. We need investment. We will give you equity. So this is not a charity project. It's a business, and I want it to be treated that way. It's like the first ever business around menstrual hygiene, the most untapped, untalked about subject out there for women. And I want the seriousness from everybody. That is why we don't have a donate now button. I want business proposals on my email ID.
That's fantastic. And as I said, you're a serial
Can I
entrepreneur.
react to that, Faiza?
Please, please.
Yes. It's really amazing what you're doing, and it reminded me of a work I once did for the local government. There's a department for interior and local government in the Philippines, because women in disasters, it's really something that it affects women differently than men, really. Women are inherently really vulnerable, and it was really a big effort to have those menstrual products, sexual and reproductive health, contraceptive pills, um, included in the packages, that in the hygiene kits that we were giving out to displaced families in times of disasters. And the work that we did in that area allowed for the inclusion of those in the national policy. And my work really is gathering evidence on showing how disaster affects, you know how disaster and humanitarian crisis affects women specifically in the internally displaced population, and how we should help them find a voice, be their voice, because they're usually rendered, voiceless. And I believe that we can do it at policy level, and then what you're doing at the granular level. So actually, the reason why I got involved in the COVID work in my country right now, I'm doing a lot of policy work, is because I was thinking of all these women living in internally displaced population. So we came up actually with a unified algorithm for women about to give birth, because right now in COVID, it's so COVIDized, There's so much COVID. Everybody's so focused, like it's COVID, and then so what if the woman who's pregnant and about to give birth is COVID positive? Will it change the outcome? She's still gonna go into labor. So why are we treating it so differently? And like, you have to require that they have to be like this and like that. And there's even this notion that you have to separate the mother and the baby, the dyad, just because the mother is COVID positive. I said, you know, it's so difficult, and you need to help women like us to get that message across. And I'm so happy to hear that from you. Really, you're so
That's fine.
inspiring.
That's great. And Dr. Tasnova, I'll come to you. We started really delving into women's business and women's issues. So tell me, what is happening in those areas, reproductive health, menstrual hygiene, and stuff like that, for the refugees you're dealing with?
Yes, women are suffering a lot in case of giving safe delivery. So we are focusing on to ensure the safe delivery service, safe abortion, and the hygiene kits. Also, we are providing hygiene kits to our patients, and also to the, I said about the community safe spaces and door-to-door service also. And we have started two isolation and treatment center for COVID-19 cases. We ensure that all the women and girls can get the healthcare services, the treatment in a separate isolation space, separate maternity ward to ensure the safe delivery and postnatal services, this kind of thing. And we have a good COVID-19 referral system also for the pregnant mothers and for the IMONG services like emergency maternal and obstetric services. And the women are actually struggling with, I completely agree with Tanzila, that they get lack of access to the information as they cannot access the internet, or they don't have any Android phones. So we have to struggle with this, that they get the proper information that this service is available there. If you go to that place, you will get this service. So they don't have this type of simple information. So we are struggling with this. We are trying our best to provide this information to the women and girls and ensure
So
their behavioral change to accept the services. Yes.
so what would be one thing if you know, if you're meeting with the prime minister or the minister, or you know, the head of the UN, what would be one thing that would really change this game?
Yes, we think that we are focusing on engaging the woman in our planning, and if we know their individual or unique needs, what they want actually. So we'll still we are have developed like feedback website where we are collecting the feedbacks and input from the women and girls in the community, and we are accumulating them, and we are working on it, and continuously updating our strategy and system also.
That's great. And Dr. Aileen, the same question for you. What is a game changer for you?
A game changer would be going beyond lip service about gender equity. Yes. We always say that, you know, we value women, we value their voice, but do we really value the voice of women? Do we really listen? Um, you see, there is this inherent, I don't know if it's cultural or something that seems to stigmatize that women who push back are deemed too aggressive. Well, if it's the same, if it's a man who does the same, then they say that he's strong. But if it's women, it becomes the same character trait becomes negative once it's a woman. There seems to be an inherent bias just because we were born with two X chromosomes. And there are traditional roles that women take. And it seems that we are taken for granted and we're some sort of punished because of that traditional role. Like, for example, women are traditionally nurturers. We are traditionally carers. And are we to be punished for that? Why am I saying that we're being punished? Because traditionally, since women are carers, we're nurturers, the traditional role is for women to stay at home. And for the men, the hunter-gatherer, to be out in the field. So women now becomes economically dependent on the men. And when the men, because their lifestyle is so aggressive probably, they usually have shorter lifespan. They would die. And then they leave the women widowed, penniless, with no means of livelihood because she was used to being economically dependent on men. And since they are usually in the home, in the healthcare system, they're usually the ones tapped to be community health volunteers. But the word volunteer alone, it means that they are not being paid to do a very important work. And if we
Yeah.
look about the healthcare system, 70% of healthcare workers globally are women. But yet, most healthcare systems are led by men. So women occupy the bottom rung, and as it goes higher, less and less women are there. Even in professorial tenures, even in researches, there are less women who get published. And for men and women occupying the same positions and doing the same jobs, women are usually paid less. Why is that so? And then there are even stories like, oh, I would rather hire a man because a man wouldn't get pregnant and I wouldn't have to pay for maternity leave. Something like that. I mean, it's there's something wrong with that. There has to be some system change that if you're saying that you value women, you have to change the system in order for women to have access to the same opportunities as men without, you know, without making them feel bad that they have to be out of work, out of the home. Because sometimes there seems to be a dichotomy that if you're a working mom, you're not exactly a very good mom because you don't have the same time spent with your children. Your house is not as spick and span as a full-time homemaker. And so some women are being asked to make such difficult decisions between choosing to be the taking the traditional role, and so we need to have more empowered women at the same time, more um not emasculating, no, I don't want to use the term, I mean men who are more secure about
Yeah.
themselves, that they would be able to support their wives, their daughters, and make them achieve their full potential without punishing them for going that, climbing the ladder of success and saying that, oh, the reason why you're not married is because it's a choice. I mean, those are things that like that. And then lastly, I would want to see women who are usually, community health volunteers like the one I'm working with, for their work to be valued. Because I have read in a global economic report that actually 50% of the work that women do in healthcare are not being paid, fairly, or even paid at all, because they're considered as volunteers. So they could
Yeah.
actually, contribute more to the economy and to the GDP if the work that they do is fairly compensated and valued.
That's great.
Because the moment you're
That's
not
great.
paid, they think that the work that you're doing is not, it doesn't contribute to anything. It doesn't amount to anything because you're not paid for it. It's like being a housewife. They think that being
Yeah.
a
Thank you
housewife
so
is,
much.
you know, yeah, thank you.
Yes.
Thank you,
Thank
Faiza.
you so much, Dr. Aileen, for the this response. And I guess the core of it is that we really need to look at structural bias, from a system viewpoint. We need to look at our culture, we need to look at the systems we are part of, and we need to look at how we value women and value women's labor and women's time and value the care that women give, because that has a monetary value that if we put a dollar sign to it, it would really increase the GDP. Even housework is something that women do voluntarily without it having a dollar value to it. So I guess you're saying, let's not pay lip service. Let's really acknowledge women um, in the way that men are acknowledged. And I guess this is the feminist um, beat that we're all drumming on. Thank you for that. So, Tanzila, you said the thing that would really support the work that you do is investors. Um, so I'm gonna ask you a question. How much are you looking for to get your work from where it is to the next level where you want it to be, business time?
I'm not looking for a lot, but The last time I checked my numbers, we are raising our round one, and which is 4 million US dollars. And we are in talks with some investors from Europe. But the conversation is going on. I'm glad that the conversation is happening, because somewhere, even if we don't get the investment, we have planted the idea of SRHR and entrepreneurship in the heads of these investors. So somewhere there is a win-win, and that too is kind of enough for me, considering the type of battle we're fighting over here. So the fight is on, but I'm also trying to create a story over here, Faiza, that we became sustainable because of our sales, and because we identified an issue, a market that needed to be tapped. So somewhere deep down, I'm like, we need to push more towards sales. So we encourage women to support this business, and they do come forward. They love our service. They love some of our products also. For example, I've innovated this box to dispose of used sanitary napkins. The conversation, the environment friendly way to dispose of used sanitary napkins has never happened. And it is such a big environmental issue. We don't talk about it. We don't talk about periods at all. So talking about climate change and bringing in these, cross-cutting conversations helps to make sure that this problem is owned by everybody. Another thing that we made was a blood stain remover. Sometimes when women just roll on the bed, the stain comes on the bed. In the morning they wake up, they have to rush towards their office or school, but they're like, oh God, I have to clean the entire bed sheet. So we developed this formula that I use to just clean off the stain so that they can carry on with their opportunity and not let periods become a barrier. So I would be interested if we can get international patents for these products and we're able to sell these products worldwide. And if you allow me, I would also like to answer your previous question to my other two panelists, which I was thinking about. I loved what Dr. Tasnova and Dr. Aileen said, and I feel very intelligent because I was thinking the same. The thing is that I think a game plan that we require right now is to have this massive call for bringing all the housewives together on one platform. I don't see that, we glamorize a lot of other roles that women play, but we've never really glamorized the role of a housewife. And being part of media myself, being a filmmaker myself, I have yet to see a billboard or a media representation where the role of a housewife is respected. I've only seen that happen on a billboard when she is trying to sell saucepan, which is not what I mean. What I mean is that we need to have more campaigns. We need to have massive campaigns, and not just on Women's Day or Mother's Day. We need to have a campaign all year round, engage all the groups, and try to identify these women who are doing spectacular jobs in taking care of a family. I mean, as a businesswoman, I see a housewife as the perfect employee that I could have. She's hardworking, she's punctual, she's on time, she doesn't ask for money, and she's so great. So she needs to be celebrated, and I want her on my team. But platforms like WOW, like United Nations, all the partner organizations, we need to come together and have this massive campaign. I would have loved to become a housewife, but somewhere I was fearful that if I do that, if I go ahead, if I just look after a household, my husband and my children, I might not be respected enough. And I'm like, hey, how did that happen? It's a cool job and I'm so suited for it. So I think before I get married, we need to run this campaign.
That's great. That's a fantastic campaign. I'm really looking forward to your housewife campaign. It's just a fantastic idea to think about. Ladies, we've got a few more minutes. And I guess for me, it's coming back to the question about, the rural-urban divide and the challenges you talked about, being people being out of the system and struggling in that space, and in particular women you talked about, just by being women. Yeah. What about girls? We talked about, the housewife, the widow. What about girls? How are girls managing in these difficult times?
I think we should raise our sons. We should raise our sons well as well.
Yeah.
So that
Yeah,
we
that's
will
a
be
great
able
thing.
to. Yeah, I think we should raise our sons to see women in a different light.
Yes,
That they
yes.
should treat women the way they treat their mother, the way they
Mm-hmm.
treat their sister, that
Mm-hmm.
they should value every woman that they come in contact with.
Yes.
With
It.
girls today, I believe that they are more um, they're more exposed to a lot of things. The diversity of their experiences is so different from my time. Even like I have a daughter myself, she's 20 years old and she's in college. And I was thinking more, Faisa, of how COVID impacts young girls today, because it has really curtailed a lot of freedom. And
Mm.
um, and it has, it has limited their, despite their tech savviness, that they remain in contact with their friends socially, it has limited their physical interaction. And I just don't know how it would be, a year from now or 2 years from now in terms of mental health. So I think there has to be a program for which we can address mental health issues, not only among young girls, but in the young population as well, because this pandemic will define that generation. This pandemic will be
Definitely.
something that would scar them, and this is something that they will carry on for the rest of their lives, and it will define how they would view things. So we need to come up with something like a program to address mental health issues that would crop up
Yes.
in the younger
That's great.
generation. For sure it's going
Yes.
to happen.
And the risk of gender-based violence is increasing. We are also, and all other the aid workers here are working on the protection sector and mental health and psychosocial support also. And we are providing some incentives like foods and cash incentives also, cash vouchers for the woman. And the child marriage has increased a lot because of the financial instability or the uncertainty of the future. How will they raise up their girl child? So it's better to just marry them. Yeah.
Yeah, that's quite an interesting thought, and I don't want to leave on that one. Zanzila, give us some spice so that we can leave with a positive note.
I think the best spice that we can have in life is that of hope. And we still have to be hopeful. We have to focus on the bright side. It is a time of uncertainty for all groups, everybody together. But we have to stand united. We have to make sure that the person next to us, the person, our neighbors, people that we're in touch with, we have huge networks that we're part of. We need to step out of our comfort zones and take ownership of all of them. We need to be more open and available to talk to. And we need to come out of our own cocoons, of our own designations, and sometimes even out of our own genders, and sometimes play the bigger role. It's true that it has been a big fight. We all were fighters long before this COVID happened. And I agree with Dr. Aileen when she says that everything has been COVIDized. I'm sure this is going to become a term very soon. We cannot let go of issues that were already there. They are important issues as well. Climate change is still an important issue. Talking about gender, I think that when it comes to menstrual health care, there's a lot of shaming that happens. It may not happen directly, but then there's a lot of corona shaming also that is happening. So we need to have more campaigns where we support corona patients who have gone through it. And corona is different because when previously if one of our family members or friends was ill, we could go to the hospital, hold their hands, be there with them. But if we have a corona patient around us, there's so much shaming, even in the most elitist, educated communities here in Pakistan, at least that's what I've experienced. So for me, I think that is also a pandemic that we need to handle, our own biases that they're coming out. So as you asked for some spice, I have to say that I would like to share my hope, hopeful, hopeful attitude towards the future. And I'm doing a lot of gym these days. So hopefully I'll lose a lot of weight by the time this entire phase is over. And I'm learning how to cook. I finally learned how to make tea. So I think the focus has to be on what we can achieve. And
That's
so yeah, so I think that and I enjoy Sri Lankan tea a lot. So that's like my globalization happening right here in my room. I won't let go of the global connection that I have.
That is awesome. Thank you so much, ladies. What a fantastic discussion we've just had. I've learned so much. Thank you, Dr. Aileen from the Philippines, the chair of the World Organization of Family Doctors, Dr. Tasnova, who is a public health professional working in the space of humanitarian crisis, and the author, the filmmaker, and the serial entrepreneur, Tanzila Khan. Thank you, ladies, very much. I would like to thank people who've made this session accessible. I also would like to have a shout out to the Australia WOW team. And up next are WOW sounds and WOW big ideas from amazing women around the world.